Dada,
Hey, what's
what
on?
are burns?
Okay, so burns, we're talking about when a patient gets burned, right? And there's a lot of different types of burns, but let's talk about the time frames after a burn. So you have the emergent phase, which is usually the first 24 to 48 hours after a significant burn. Then you have the acute phase, which is normally 48 to 72 hours after a burn. And then you have the convalescent or the rehab phase, which can last up to a year. Nurses have to be focused on what are they potentially, statistically speaking, going to be expecting during, like, let's say, the emergent phase. Of course, airway becomes always a priority, but when somebody burns themselves, if they burn themselves for a BSA, a body surface area of 25% or more, and if they have at least a partial thickness burn, that means that they've affected the dermal layer, all the way down to the dermal layer where there's a lot of vascularization, a lot of blood supply there. So the patient's going to be looking for hypovolemic shock. They're going to be at risk for hypovolemic shock. So as a nurse, we have to ensure that we're looking out for indications of hypovolemia. We have to put a Foley catheter in the patient to ensure that we're monitoring the intakes and outputs, or in particular the output. And we're also making sure that the patient doesn't develop other complications. They'll probably have an NG tube placed because you can develop a Curling's ulcer, which is an ulcer of the stomach caused by, of course, the dehydration and the increased stress of the actual burn, the physiological stress. At the same time, you're looking for potentials of hyperkalemia, high potassium levels, because as you're destroying the cells, they're releasing all of that potassium into the bloodstream, so you have to monitor for cardiac arrhythmias as well. And that's going to be primarily the emergent phase.